While I was preparing for a talk last year, 2022, I found a study that was really interesting, and it's called Estimating the Impact of Food Choices on Life Expectancy, a modeling study. It states that changing from the standard American diet to an optimized diet at the age of 20 adds 13 years for a man and 11 years for women. And if you're 60 years old, it's 9 years for a man and 8 years for a woman, which is quite substantial. And if you want to see how a change could affect you at your own age, the authors published an online calculator, which is called the Food for Healthy Life Calculator. And if you look at the calculator, you can see that you can put the location. So the diet is like for a general area for US, Europe, Norway, and another one I forget. I think maybe Australia. You can put your age, you can put your gender, and then you can have two choices of diet. So you have the optimal diet or feasible diet, which is in between optimal and the standard Western diet or standard American diet. I think they're the same. And yeah, so it's very interesting calculator. And with this, I found that even for my parents, aunts and uncles who are in their 70s or close, a switch to an optimal diet is predicted to add 7 to 6 years of healthy lifespan, which is quite a lot. And for me, who in my 30s, I can add 12 years to my life. And then for the younger generations, for the kids growing up today, it gives about the same extension of lifespan as for somebody in their 20s. So adopting an optimized diet is better the sooner you do it, but it's basically never too late to do it. And then the next question is like, how was the results produced? Well, the authors found this by using meta-analysis of the health effects of different food groups. So that means they're using studies that include multiple studies on each food group or food category they were studying. So you might be asking, what is an optimized diet for lifespan? Well, the main take-home message were that the largest gains would be made by eating more legumes, whole grains and nuts, and less red meat and processed meat. And if you look at the main figure, you can see how it works. The highest effects were for the food categories I just said, and then lower, as you see the lines down, have less impact on life expectancy, but still have some effects, some noticeable effects, such as reducing sweet beverages, so like pop, refined grains and eggs, and also increasing fish, fruit, and vegetable. And then after that, the last three ones is a slight reduction in milk, white meat, and added oils. I mean, a reduction, but the effects are quite small. That's what I mean. So if you want to know the detailed description of the optimal diet, then you can press pause and take a screenshot of this list that I'm showing. And there's 3 diets described here. So there's the typical Western diet, TW, the feasible approach diet, which is FA, and the optimal diet, which is OD. And then for the ethical vegans listening to this, well, it might be frustrating to see that the optimal diet included animal products, but this study did not consider ethics or did not consider sustainability, right? So, but still, the study did recommend to reduce white meat, eggs, and dairy. It's just that after reducing it to a certain amount, there was no more further gains in life expectancy according to what they found, according to the meta-analysis that they used for the study. And then for me, who switched to a plant-based diet at the age of 33, I added 12 years. But I did not switch to the diet that is recommended in the study. I cut all animal products. So I put my diet into the calculator, and I found that I basically had the same life expectancy change from my switch. But there was one major difference: fish. I found that theoretically, if I ate fish every day for the rest of my life, I could add a few months to my life. But I could argue that, since fish, the main reason why they're healthy is that some of them contain omega-3s. If I could eat omega-3s from other sources that do not deplete the oceans, I could still have the same benefits. So today, I'm interviewing Lars Fadnes, the lead author of the study. He's a professor at the Department of Global Public Health and Primary Care at the University of Bergen, and research group leader at Haukeland University Hospital. He's a medical doctor and is a specialist in general practice, as well as having a diploma in tropical medicine and hygiene. He has worked with research on dietary patterns and associations with chronic diseases and has had substantial international collaborations with researchers from the UK, Uganda, South Africa, Italy, Australia, and the US. His research spans across several themes, mostly focusing on nutrition and associations to chronic diseases, substance use, and migration. He has more than 100 scientific publications published in international peer-reviewed journals, as well as being covered in many hundred newspaper articles. He has also been central in the development of guidelines both nationally and internationally relating to both nutrition and substance abuse, and the treatment of people with substance abuse. He is a part of the Norwegian National Advisory Panel on Nutrition and the Norwegian Scientific Committee for Food and Environment. He has received awards for research and innovation, including the Meltzer Award for Excellence in the Dissemination of Research, Young Researcher Award for Health Research in Western Norway, Falk Jr. Award for Medical Research, and the Prize for Research and Innovation, and has several articles on the Altmetric Top Rank List, which is a list on the research that most caught the public imagination worldwide. Lastly, he's also the founder of a publishing house named Grønt Forlag, which means green publisher. The first publication was this book, with the title meaning From Small to Large, Everything About Plant-Based Nutrition, written by him and also two co-authors. So in this interview, I asked Lars about the study, and the conversation becomes very sciencey. So I hope you'll still be able to follow and learn from this interview. So for no further ado, here is the interview. So, hi Lars, how are you doing today?
Yes, fine, thank you.
Good. First I would like to know, can you talk more a bit about your work? I know you do lots of projects. Could you give an overview of the projects you work on?
I could say a few words. Do you want me to hold this? Yeah. So I work. First, I'm a medical doctor by profession, but I've been doing a lot of research on nutrition, which is one of my key interests. I specifically focus a lot of on eating patterns and chronic diseases and life expectancy, and some of the work is related to modeling, some is related to meta-analysis and systematic reviews of other studies. So and then I also have research going into other directions of public health and behavioral choices and how that impacts on health.
Yeah, I noticed. I read a bit about you, and I noticed that you work on a lot of stuff, and you lots of publication on many subjects that are all related to like health, I would say, and well-being, and not just for Norway, but also for people in impoverished nations, right? And for children, it's a very big breadth of questions to work on. But today I want to ask you about the diets, right? So I prepared some questions here. How diets affect as treatment and prevention of chronic disease. So that's it. And so I found one of your studies, and I really liked it when I found it. It was really informative and well done. It's called Estimating Impact of Food Choices on Life Expectancy, a modeling study. So when I found it, I want to say that what I liked about it is that it gives a relative importance of food choices. So, when people often could argue, they can often argue like processed grains are very bad, processed foods are very bad, and some people will say no, like saturated fats are bad, and people can argue, and there's kind of like a war on the internet and probably in research as well on like what to focus on, and some people could not agree on that, but this study can actually give a quantitative estimate on the importance of these things. So I really love that. So then it can guide people to adopt better food choices, I think. And the study was like also looking at life expectancy. So I think it's a good metric to measure the impact of foods, because everybody wants to live long, and most people want to live long, and I also assume that life expectancy is also very linked with quality of life, right? Yeah. Could you tell me a bit more about this study? How did you do it? And could you tell me more about the study, basically?
Yeah, I could say a few words. As you said, our purpose was to provide a tool that could help people in having an overall understanding of how different eating patterns is associated with life expectancy and health. And that was the basis for the Food for a Healthy Life project. And then it is, as you say, possible to take different perspectives. We used a food group approach, so it could be possible to say to look into how the different types of macronutrient compositions, for example, how much carbohydrates, fats and proteins do people eat, etc., or how much of different vitamins. But there is more good research on food groups. So we based this study on meta-analysis that have combined estimates for more or less all of the large cohort studies that have been published on intake of these food groups, approximately 15 food groups, and how they are related with life expectancy in the first case. We are also now looking further into how are they associated with disease-specific estimates for example, cardiovascular disease, cancers, diabetes type 2, and obesity. And then we needed to develop methodology on how to kind of bridge this together, because it is known that the different food groups, they are to some degree, and the eating of these are to some degree correlated. So some people that eat a lot of vegetables, they are likely also to eat slightly more of fruits, etc. And most of these studies have tried to disentangle and to adjust for that a bit of this correlation, but not completely. So we built in some model adjustments where we accounted for this degree of overlap between the associations in food intake and life expectancy, and then we used assumptions on background mortality, on life expectancy for the kind of general population, based on data from the Global Burden of Disease study. So we estimated what was the kind of risk to die within each 5-year status from early adulthood and up to throughout life. And then and then we applied the food related changes onto the baseline estimates of the mortality. So if some people had typical dietary patterns and optimized their dietary intake, for example, by increasing intake of legumes, nuts, fruits, vegetables, etc., while reducing, for example, red and processed meats, that would then translate to life expectancy gains throughout life, more when changing from early adulthood, and slightly less when postponing these changes to later in life. So we tried to model what could people expect of gains based on different changes applied at different times in life. We also implemented we needed to also develop methodology on how to account for time delay. So we assume that based on other research that has been done, that when people do changes, the benefits does not come or is not full immediately, but that it's kind of increases gradually within some years, and then plateaus at around 10 a duration of 10 years. And we tested what does happen if we reduce that to 5 years or increase it up to 30 years. So we did a lot of sensitivity analysis where we tested different scenarios, and all of these they showed more or less the same picture with slightly different estimates for the gains.
Wow, thanks. So that's a very thorough response, and lots of information in there. So wow. Okay. So yeah, it plateaus after 10 years. So that means that after 10 years, like you've had the maximum of gains. But if you were to revert back to a diet that is less efficient or less optimal for your health, then it would be interesting to see how that works as well. But I guess this is so much of data, but this is based on lots of people. Like I assume like tens. I forgot the numbers, but like it's meta-analysis of many studies, and so these people, I assume, like they made the switch and then they maintained the switch for many years, right?
I could say a few words about that. And as you say, the background data were from a bit different from the different food groups. Most of them were in the range of 2 million people that where the background data came from. So, and relating to this the duration of change aspect, generally the longer beneficial changes are kept, the better, to say it simple. So but our assumption that we tested different scenarios to was rather to see what happens in the first years after a change. So let's say that if I had a very unhealthy eating pattern today, and if I and had that for a long time, if I changed at this time point, it would I would not have kind of an optimal profile tomorrow. It would take some more time before the kind of risk profile would be optimal, and then still that change in disease risk would need to apply to the background risk. So let's say a person in his 20s has a background risk of chronic diseases and death which is very low. And so changes in that period would be beneficial changes, would give a slight gain, but the risk is generally so low in that period, while when the risk of chronic disease and risk of death increases, then the relative gain will translate into more absolute differences. For example, in the 60s, there is a much higher risk of cardiovascular disease, cancers, etc., which were the data on healthy eating and indicate that there is a substantial gain in optimizing eating patterns in terms of associations to chronic disease, and then the same changes would translate to quite a lot of reduction in cardiovascular disease, cancers, etc.
But yeah, I had some questions about actually how these food groups affected, so about the mechanisms. And I actually assume that you didn't dive so much into the mechanism. It's more about the analysis of the data, and the data is actually like, oh, this food has that effect, I mean, on lifespan. But of course, there's a lot of literature on the mechanisms themselves. Are you familiar yourself with how the food groups affect each how can they affect lifespan?
Yeah, it's a good question. And as you say, this study did not go into the mechanisms primarily. So this had an empiric approach and presenting the data from epidemiological studies. But we also we have looked into quite a lot of studies that look into different mechanisms. So we have some ideas on what are some of the main mechanisms. And it is probably quite a range of mechanisms involved. Also likely to be slightly a relative difference between the different diseases that healthy eating is likely to prevent. For example, relating to cardiovascular disease, it is likely to be a lot of factors that impact on vasodilatation and also on reduction in oxidative stress and with antioxidant properties, which are assumed to contribute to a reduction in cardiovascular risk profile. A bit similar also for cancer risks, that many, for example, of the fruits and vegetables and other plant groups, they have quite a lot of phytochemicals with properties that have cell protective properties. The antioxidants as one of those, but there are quite a lot of different components contributing to that. Also, the macronutrient composition, the energy density is also probably part of the mechanisms particularly related to diabetes, and also the fiber and how the metabolic aspects. So there are likely to be several mechanisms involved, but some of these mentioned.
Yeah, I know. I ask you a question that's very huge. It's a whole universe. Like all of these foods have different mechanisms on how they will impact our health. But I was curious, like, when I read about this study, that it was very very interesting. I mean, I was a bit surprised by some results. For example, about fish. So the only animal-based food that was suggested to be increased was fish, actually. And I say I'm surprised, but to be honest, not really, because it's been always been promoted in literature, in like governmental policy to increase fish consumption. But how does that work actually? So my understanding is that one of the main benefits of fish is actually the fatty acids like omega-3s. That's what I know, and that they're protective for cardiovascular disease and also for the brain. But at the same time, they do also carry components that could be harmful, that are contained in other animals, such as saturated fats and also what's it called, cholesterol. So could you elaborate on that? What's your perspective on fish, and why is it beneficial? Why is it recommended?
First, so this our modeling is trying to integrate the health aspects relating to life expectancy, and there are a lot of other aspects that needs to be taken into consideration when choosing what to eat beyond health. But we had an empirical approach to this, which tries to kind of look at the totals independent on what type of mechanisms that could contribute in either direction. And for several of these food groups, if not all, there are factors that contribute positively and negatively to life expectancy, or at least are very likely to do that. As you say, for example, fatty acid composition is one aspect in terms of fish that is assumed to be generally positive, with a lot of long chain of omega-3 fatty acids, and limited with saturated fatty acids, in contrast to several other animal-based products. Still, there are some aspects, especially when increasing intake substantially, such as toxins that are particularly high in some sea food products and some and several fish products. So which in high dosages are likely to be negative. Still, the details on how much and to when, which are, and the quantification of the potential negative effects of these are a bit uncertain. And that's part of the reason why using empirical data kind of tries to at least summarize when taking all of these aspects into account, at least all of the health-related aspects. But health is not everything.
I mean, Yeah, like I understand that it's we're not in a state of perfect understanding yet. I mean, perhaps we will never be, but that's why. But empirical data can condense. I mean, it will contain all this information. We can disentangle, but we can still gain some really useful knowledge from that. And it's been shown in those meta-analysis that indeed, like eating certain amount of fish and actually more than the Western diet actually is a good thing for most people. Yeah. Also, something that was interesting is plant oils. So that's the least impactful thing, I think, in the study. I look at the figures and like it didn't seem to have any change, and that's surprising. And because there's some people that say, oh, there's plant seed oil is very bad, you should avoid it. But according to your study, it didn't matter really, and the study recommended to keep the same amount as what's eaten in the standard Western diet.
Yeah, and it's important to take into consideration that for the different food groups here, there is different degree of evidence, and for example, whole grains, the evidence is rather strong. Nuts, the evidence is also relatively strong. For fruits and vegetables, it's also quite strong. Also for the protective and aspects of reducing intake of red and processed meats, while for added oils, and also this a bit similar for eggs and for white meat, the evidence is very weak.
Yeah.
So that needs to be read with a lot of caution, or that there is much more uncertainty relating to added oils. And actually, research could indicate that there are differences between different types of added oils. So, for example, olive oil is most likely more healthy in terms of life expectancy and cardiovascular disease than, for example, several other added oils, corn flour oil, soy oil, etc. So there is likely to be a range from probably more beneficial to probably slightly or less beneficial or slightly harmful.
Yeah, so we're talking about plant oils. There's limited evidence, but at the same time, my takeaway is that it doesn't seem to matter too much. It's good to make good choices, but it's more important, for example, to eat more legumes, more vegetables, more whole grains. Those are and then reduce. Like that's the main takeaway of the study. Reduce the processed meat and red meats. Yeah. So in your study, you had two diets. You could choose the optimal diet, but also the midpoint diet. So this was said. This was explored because it was assumed that there would be lots of difficulties to adopt the optimal diet. What were the obstacles that you would envision for people who want to take the optimal diet?
I think this is a bit person dependent, but for many, eating relatively optimized or not necessarily only thinking about health could be relatively feasible, but it's a spectrum. So it's not for few there is complete optimization or no or kind of complete unhealthy eating. So most will lie somewhere in between, and thus we also presented for this kind of midpoint between unhealthy and very, very, very healthy eating. So to kind of say something, what can people expect if they do some positive changes?
Okay, well, we don't have much time. I mean, you are very busy, so thank you for your time. That was really appreciated, and yeah, have a good day.